So good afternoon all. So welcome to today's Facebook Live program. So today's Facebook Live program is on the topic of alcohol, de-addiction and its awareness. So to talk on this topic, we have with us Dr. Rahul Khemani sir. Sir is eminent psychiatrist practicing at Borivali West at Heart and Mind Clinic at Ganjawala Lane, Borivali West. So sir will going to give us the idea about what is the alcohol addiction and how the one person can become addicted and how to stay away and we can come out successfully and live a normal life even after the alcohol addiction. So over to you, sir.
Hello everyone. Hi, this is Dr. Rahul Khemani. I'm a consultant psychiatrist practicing at Heart and Mind Clinic in Borivali West, Ganjawala Lane. Today, I'm going to deliver a talk on addiction and de-addiction, particularly focusing on the alcohol addiction. So we all know that addiction is a major problem in our society currently, and there have been multiple implementations done to ensure this addiction does not happen, but unfortunately, none of those work. So what is addiction? Addiction is a neuropsychological condition. Neuro meaning brain, psychological meaning the way we think, the way we feel, and thus the way we behave. So it is basically based on the mind part of the brain. And even though a lot of people think that addiction is a choice, what they are confusing this addiction choice with is a choice to have drinks or smoke. That's different. That's recreational use. There are some people who maybe drink or smoke once in a year or something. So how do we differentiate between those people who use it recreationally very rarely and those people who use it very regularly and are absolutely addicted to it? So how do we know if someone is addicted to something? So to understand that, let's understand the basic biology of addiction. What happens in addiction? Addiction is something which goes and stimulates the brain. So with that stimulation, there is a release of a neurochemical called as dopamine. This dopamine is also called as a pleasure hormone or chemical. Pleasure, happiness, ecstasy, extreme kind of feeling where you just feel good. Who doesn't want to feel good? And that is the reason why every time you take that substance, we call it as a psychoactive substance because it activates the psyche, the mind, in a positive, pleasurable manner. But unfortunately, this pleasure is an external pleasure which is not controlled normally by the body. And thus, if there is anything that is disturbing the brain, it is going to harm the brain. So with the release of this dopamine, we call it as a dopamine kick. You feel very high. And thus that high is good. It makes you feel that you are all away from your stress, from all the problems in your life. You just feel very relaxed and you just don't want to worry about anything at all. Unfortunately, it is short-lived. The feeling goes away and then you start feeling normal again. And that is when you want this high feeling again and you take the substance again. This keeps on repeating up until the point where it causes a problem. And because of the problem, we call it as an addiction. So then let's look at the signs and symptoms of this addiction. How do we define it as an addiction? Simple. If you want to define something as an addiction, it's the difference between a need and a want. What is need? Need is what I need to survive. I need air to survive. Yes. I need water to drink to survive. Yes. I need food to eat to survive. Yes. These are the basic needs. But what is a want? I need to eat food, whether it is dal chawal or a burger. But do I need to eat a burger? No, I can manage with a plate of dal chawal as well. So this is the difference, where if I'm demanding burger and I'm refusing to eat dal chawal and I'm saying that I just like burger and I'll keep eating that because it makes me feel happy. It is not something that I need for survival, but I keep on insisting and I keep on doing it. That is addiction. So you cannot get addicted to your normal air, oxygen. You cannot get addicted to your normal water and food, normal, basic. But if you're becoming aggressive, if you're becoming very demanding that no, this is what you specifically want, and you refuse to listen to any reason, that is the point where we become addicted. So addiction is not only about substances such as alcohol, cigarettes, cannabis, cocaine, and so on. It is also about certain habits as well. For example, when I get using a lot of phone, that is phone addiction. It also causes release of dopamine in the brain. When I am kind of um, gambling, when I'm spending money without any rhyme and reason on such gambling, such as playing cards and things, then I'm again getting addicted. Because when do I get a high during gambling? When I win. When I win a lot of money, I naturally feel that I'm going to keep on winning. So this is how addiction begins. And how do I define that addiction is strong or weak? It depends on two things: craving and tolerance. Craving meaning the desire to go and use the substance. For example, my desire to go and drink, despite the fact that I know where am I, what am I doing. For example, I'm sitting in my workplace and I should be focusing on my work. So a recreational use will be maybe on a weekend, maybe on a holiday. But a person who is addicted, what will they do? They will go and drink in the middle of their work itself. They will go and drink when there is some family occasion and you're needed to be sober. You don't care about what is happening in your surrounding. All you focus about is your desire and your need. Then comes the second part, that is the tolerance. I start with a small glass of drink, but slowly this keeps on increasing. A small glass becomes a big glass becomes a large glass, and a large glass just keeps on increasing up to the point where my body is getting damaged. Now, this is another equally important point. Addiction also means that I'm absolutely not worrying about my body. I don't care what is happening to me. I know that I might die because of this drinking, but I still will not stop. I know that this drinking is affecting my social relationships, maybe with my partner, maybe with my family, with my friends, but I don't care. And lastly, and most importantly, it also affects your work, but again, you don't care. And you don't care if you quit and everything. It goes to the point where if you don't have money for fulfilling your addiction, that is, if I want to buy a drink but I don't have money, then I might beg, borrow, steal, do anything I need to get that alcohol. And that is how intense the person feels during addiction. In fact, it is comparable to breathing. This is something like an exercise that people have been told to understand addiction. If I ask you to hold your breath, you will be able to hold it for a few seconds. Maybe you will be able to hold it for almost a minute as well. But after that, there will be an intense desire to breathe again. This intense desire to breathe is what people who have addiction constantly feel. And what I'm pointing towards is a change in the brain. The brain has a change because of which you start constantly feeling that you need to have that substance. So you don't care, you don't worry. I mean, that's obviously something that we all think. How can they be so disregarded? How can they not care about their family? How can they not care about their job? It's because there is a change in the brain. And the only thing that is running in the front of your eyes in addiction is to get that substance. It goes to the point where it becomes so extreme that person gets into anxiety disorders and depressive disorder, and eventually such persons are highly prone to attempt and commit suicide as well. So it is a condition which requires treatment as quickly as possible. Definitely treatable. There are multiple medications which are available to treat both the craving and the desire. So there are medications such as baclofen, which help in reducing the craving of drinking. Other than baclofen, there is acamprosate, there is naltrexone. These medicines reduce your desire to drink, and thus you can control it if you are willing to control it. So the first step is becoming aware. The second step is trying to control, and then you will succeed definitely. Apart from that treatment, There are other options available, such as going to de-addiction centers or rehabilitation centers, wherein you get an opportunity to work on yourself. Like, for example, Alcohol Anonymous are groups which teach you how to gradually quit alcohol and get back into positive habits. Imagine this drinking problem as a habit only and a bad habit. And all you need to do is change this bad habit into a positive habit. So this can become normal and reverse again. It is not easy to treat addiction, mainly because addiction requires you to take charge. Any other treatment in the world, for treatment for cold, cough, any fever, infection, is very easy. That's because when you need to get better, you just need to take medication. You don't have to think anything and you get better automatically. But addiction requires your efforts. You have to control, and controlling is the most difficult in addiction. So those who have been able to control, sometimes in the future again get exposed to such drugs when maybe their friends or someone gives them some kind of stress or something, and they get back into this addiction again. So if you want to get treatment of this addiction, that is de-addiction, all you need to do is take help from a mental health professional. That is through therapy. There are options in therapy such as motivational enhancement therapy, motivational interviewing, in which we increase the motivation of the person who wants to quit, and that helps them a lot. The second option that is available is medications, like I already suggested. And lastly, the option is to get admitted in the rehab. But all these three options work only if you visit a psychiatrist, and they will always guide you in the right direction. Thank you. And I welcome any questions.
Thank you very much, sir. So thank you very much for this such a crisp and very informative session. Sir, here we will take a couple of questions. So as you said, the alcohol, the one person can be get addicted because of there are various factors. Can we consider alcohol as a medical condition, and we can be called the alcohol addict as a patient?
Absolutely. It is a medical emergency, and it is a difficult condition. It is supposed to be not considered as a social issue. It should not be treated where you are hitting people when you're beating them to make them quit. No, that is the wrong thing. The right thing is to go to a doctor, ask them to help, and they will definitely help you.
Sir, how this alcohol addiction can impacted in the family and the family members, especially into their children as well as the wife or parents?
So, actually, a very good question, because there are multiple risk factors. For example, someone in the family, when they're drinking, you automatically think that this is normal to do, and you also start drinking based on that. So, family history of addiction is a very strong factor in involving children. Children who start very young get deeper into addiction, and the treatment is far more difficult as someone who starts drinking later in their adulthood, because they may be drinking because of some stress, and that stress, once resolved or taught some stress management techniques, can also help in quitting addiction. Apart from that, there are other risk factors as well, such as the availability of the drink, the kind of if you don't have that kind of worry about spending. It is also about the peer pressure, where you have those kind of friends who keep on insisting, forcing you, or the kind of partner who keeps on kind of bringing up the topic of drinking, and then you automatically get pulled into it.
So thank you very much for giving this information. My next question is, as the family is as well as the family members are getting impacted because of the alcohol addict. So what is the role of family members so that the how they can change their behavior and the way to look towards the family alcohol addicted person, sir?
This is a very big stigma this is a very big stigma among the family members, because they feel that this is a very bad condition and they shun those people who have addiction. So they push them away, and pushing them away makes the problem worse because these people start drinking more and get addicted more. So rather, you need to care for them, you need to love them, and you need to try to help them in the way of treatment and not just scolding them, emotionally blackmailing them, telling them that they should quit for their family or anything. If they could have understood those reasons, they could have quitted back very long back. But the reason why they're not able to quit is because there is this chemical problem in the brain. And this chemical imbalance is only going to get solved with the help of treatment, whether it is therapy or medications. So family members need to be aware about this condition, and they need to make sure that they consult the right people to get the right idea of what the problem is. Because sometimes addiction, like I already said, is comorbid with anxiety conditions and depressive conditions. And in such conditions, nothing else will work except for medications.
So thank you very much, sir. You rightly said the family has to be developed one support system, and they should consider it as a medical condition and seek the doctor's assistance as early as possible. Sir, moving ahead in the next question, most of the time, even after starting the treatment from the medical professional, so after some period of time, there are few people, they can again develop the relapse of alcohol addictions. So as a family or as a society, how and we can avoid these relapses in the alcohol addict person?
Relapses are very common. Relapses are a part of addiction treatment. We expect it to happen. We prepare the patient so that if in case they relapse, they don't feel bad, they don't feel guilty, they don't run away and not come back for treatment. Rather, they come back to you, they tell you the problem, they tell you why it happened, and they are ready to get back into treatment again. Secondly, to prevent relapse, we have certain measures in place, such as teaching them how to understand their triggers and to avoid the relapse. Number one. Number two, in case they are in a high probability that they're going to relapse, then we ask the family members to start bringing them to us on a regular basis, and we keep continuing counseling. In fact, for such patients or such people who are addicted, counseling continues lifelong, and we keep doing a back-to-back session, whichever required, to support the person and to help them reduce stress so that they do not relapse. And lastly, the family members need to be aware that as soon as they relapse, they shouldn't wait and they should bring the patient immediately to the doctor.
Thank you very much, sir. My next question is, so how the alcohol addicted person to stay away from the alcohol, how they can engage themselves into the various activities, what your message will be?
Alcohol, as I already said, addiction is a bad habit. All you need to do is figure out a positive habit. That is in your hands. I suggest a lot of people to start running, because running a marathon is an addiction as well. But that is a good addiction. That is also a mechanism which releases dopamine in the brain. So you don't get the release in the first 1 kilometer, nor do you get the release in the first 5 kilometers. But approximately between 5 and 10 kilometers, you suddenly start feeling that dopamine kick because your body is enjoying it. That's how people can run 20 and 40 kilometers. Running is one of the best forms of recovery from alcohol addiction. Apart from that, spending quality family time, going on holidays, ensuring breaks in between your work is something that can also help the individual. So find out what is your kind of out of this addiction and keep working on it. Make it your special thing, and you will never get back into addiction.
Thank you very much, sir. You have mentioned very important point. The running, wherein one can invest and his time and energy, and that is another good addiction. Sir, here one more question is there. So does group therapy helps in the alcohol de-addiction treatment?
It does. The concept of Alcohol Anonymous is based on group therapy. So in group therapy, when you're sharing among people, you realize how much other people have also gone through this problem, and you understand that this is also a problem which can be treated. There are different people at different stages of treatment, and group therapy helps making it easier for people to get better together and to support each other together.
Thank you very much, sir. So I think so with this question, I think so we have covered almost all the we have touched to the all the points. And so on the behalf of Health and User, we really thank you for your valuable time and content to create this awareness on the addiction. So thank you once again for joining us for creating this awareness. Thank you.
Welcome. It was a pleasure to be here, and I hope people, y'all get ahead and get treated yourself if in case y'all are experiencing any addiction problems. Take care, everyone.